Welcome to today's press briefing. We have with us the head of the Communicable Disease Branch of the Center for Health Protection, Dr. Chang Shuk-Kwan, and Chief Manager of the Hospital Authority, Dr. Sarah Ho. The two doctors will give us the latest situation of cases as well as the HA. Good afternoon. Yesterday we have positive cases, 3,533 cases, including 1,408 cases of PCR positive cases and 2,152 verified RAT local positive cases. We have 229 imported cases, including 214 cases that are PCR positive cases and 15 RAT cases. The Hospital Authority reported one death case. I'll defer to the Hospital Authority. Good afternoon. Currently, we have 1,108 patients staying in hospitals. 158 of them are new cases. Those that are in isolation facilities, 327 of them are in isolation wards. 15 of them are in second-tier isolation wards. 389 patients are in the North Lantau Infection Control Center. 118 of them are new cases. Yesterday, we have reported 2 new cases of critical conditions. 2 patients are in a serious condition. Currently, those that are in admission, 20 of them are in critical condition. 27 of them are in a serious condition. 4 patients in a critical condition are in ICU. We have also reported 1 new death case. It's a 72-year-old male patient. He passed away yesterday. He did not come from a care home, had no vaccination record. He suffered from cancer and other chronic illnesses. And I'll defer to Dr. Chang. Of the 229 imported cases, that includes 107 cases that are confirmed at the airport. 103 were picked up at the quarantine hotels, and 19 are people who have already left quarantine hotels. They come from 48 places. Those with at least 10 cases are UK 43, Singapore 18, Thailand 18, US 17, and for the other 44 places, they are with 10 or below cases. In terms of care homes, there are some care homes that have registered cases. Some close contacts have been sent to quarantine. There are 4 care homes for the elderly and 2 for people with disability. They are 松柏國際協會、藝善康寧院、TWGHS Jockey Club 朗日居 and 1 other. For the other 2 homes for people with disability, they are 基督教家庭中心. There is one is in Tuen Mun 長期護理院, a long-term care home. Today is a Saturday. There are some schools that have reported cases to us. We suggest that they suspend classes. It's Hong Chi Tuen Mun. 晨曦學校 is a special school. Is Hong Ching class. 6 students and some of them are infected. These are special need children, so it's difficult for them to keep their masks on. In Tai Po Baptist, class K3A, there are 32 students. 4 of them are confirmed cases, so they have to suspend classes for 1 week. There is also one. It's 九龍 in Kowloon Tong. It's St. Catherine's International Kindergarten, Norfolk Road. Those who ride with bus 18 should stay away from schools. There are 4 more students as well as 1 teacher that have taken that bus. They are now confirmed. For the remaining students, they have to be under home quarantine. In terms of surveillance, suspected BA.2.12.1, 73 cases, including 64 with unknown source and 9 cases linked to others. There's also suspected BA.4 of 5, there are 32 such cases. 16 of them are related to other cases and 16 with an unknown source. That's all for my report today. In the past day, 129 patients have recovered, including 120 that have been discharged. 1 patient were confirmed to be positive upon admission screening. 3 patients in the same cubicle and staff members are close contacts. We have another 42 staff members that have been confirmed. So far, we have 25,093 staff members that have been confirmed and 16 staff members that have resumed duties. Altogether, there are 24,640 staff members that have returned to work. I have a number of things to report. In a Taipo Hospital psychiatric ward, there is a patient. On the 13th of July, the patient was confirmed with COVID. Hospitals started contact tracing and made arrangements for all patients in the same ward as well as staff members to go through tests. 2 patients and 2 staff members were found to be positive. The 3 patients have been transferred to Nathasol Hospital for isolation treatment. They are in a stable condition. 2 staff members are also in a stable condition. The relevant ward has stopped admitting new cases as well as transfer. Thorough disinfection has been conducted. The other one is Buddhist Hospital. It was related to palliative treatment ward. A 49-year-old female patient is now confirmed. Her situation is stable. She is in an isolation facility for treatment. There are 9 patients and 5 staff members that have been confirmed. Another one is orthopedics at QE Hospital, Queen Elizabeth. There are now 2 more patients that have been confirmed. They are now in a stable condition, receiving isolation treatment. For the relevant ward, so far there are 6 patients that have been confirmed. We have conducted thorough disinfection as well as cleaning. We've stopped receiving new cases and suspended visitation. The control infection team is conducting an investigation into possible linkage. We're now working with the CHP to monitor the latest situation. For the new cases, 1 of them have gone through surgery and stayed in ICU. So 10 staff members in operation theater as well as ICU have conducted intubation and this removal. There are 2 orthopedic doctors, 2 anestheticians, 3 nurses, 1 theater assistant, and in the ICU, 1 doctor, 1 nurse. In the ICU, the nurse was confirmed today to have been infected. We will continue to conduct tests for staff members as well as patients. So far, all these tests are negative.
Floor is now open to questions. Before putting your questions, please identify your media outlet. The journalist at the back. I'm from cable TV. Many experts predict that case numbers will double, creating pressure on the public healthcare system. But HKU scholars Professor Ivan Hong and Professor Yun Guoyong argue that COVID has become an endemic. We can gradually remove social distancing measures. What's the CHP's assessment regarding the experts' recommendations? Is that appropriate? For the CHP, in the next 2 weeks, will hospitalization figures increase? How much will the increase? When will it peak? The Secretary for Health attended a radio show today. His remarks have also been uploaded. The concern is the burden on the healthcare system and the impact on the vulnerable, that is their vaccination, which is because their vaccination rate is still on the low side. Now, if there are more cases in the community, some patients will require hospitalization. And when more COVID patients require hospitalization, that will inevitably affect non-COVID related hospital services. And we will have to adjust our hospital services to receive the COVID patients. I would like to make an appeal here. Those who haven't got their jabs, or if the time has come for them to get their next shots, please get vaccinated. If they don't feel well, they should seek medical attention as soon as possible. Next question, the journalist at the front. I'm from TVB. And for isolation facilities and hospital wards, how far can they cope as far as when case numbers increase? At which point will the hospitals no longer be able to cope? How many extra beds or facilities have we set aside? We reported previously we have more than 1,000 COVID patients staying at public hospitals. For those in serious or critical conditions, the numbers have risen. We reminded the public not to drop their guard. With the figures now, we're seeing an upward trend. The hospitals can cope for now, but if the hospitalization figures continue to increase, there will be some impact on our services. We still have enough isolation beds for those hospitalized. As we mentioned, we also have this high-level emergency response command committee coordinating the relevant matters. We have formulated this real name-based deployment scheme so that in a short time, we will be able to deploy hospital beds to receive a large number of patients. Next question, the journalist at the back near the middle. I'm from Now TV. Yesterday, there was an outbreak at St. Catherine's International Kindergarten. Altogether, how many people got infected there? How many classes or grades are involved? You mentioned an additional patient is a teacher. What's the source of infection? Is the same school bus driver or the nanny? Who's the source of the outbreak at the kindergarten? You mentioned at the orthopedic ward, a nurse got infected. Did the nurse get into contact with other patients? Do the patients also have to be isolated? Preliminary investigation suggests that at the school bus number 18, there was transmission. At this school, there was transmission between the bus drivers. On bus route 18, there were 26 students going to school. Altogether, 9 people have got infected, including 1 driver, 1 nanny, and 1 teacher who was on this bus, as well as 6 students. For the orthopedic ward, we've stopped taking in new inpatients, and we have also suspended visiting arrangements. The patients and staff will continue to get tested. We will continue to follow up on the situation, and we will work with the CHP and keep an eye on the latest situation. Next question, the journalist at the front.
We would like to know how many residents who were once infected in the 5th wave are infected again. What is the percentage of reinfection? Secondly, 4 Hong Kong pandemic experts call for moving towards population immunity through vaccination and natural infection to return to normalcy, including dropping hotel quarantine and gradually loosening social distance curbs. So does the CHP think that the city is ready to move on to such directions? And does the CHP agree with the experts' suggestions? Thank you.
I don't have the reinfection figure of the residents of the elderly homes, but I understand the number is not big. And our secretary has spoke to the media this morning about the expert opinion. I won't repeat here.
Next question, the lady at the far end. I'm from Ming Pao. First question for Dr. Chuang. This morning, Professor Lo Chong Mao mentioned the possibility of doing one single test for those trying to go to the mainland. For the rapid nucleic acid test, and the mainland also does their nucleic acid test, is there a difference between the PCR tests done on both sides in terms of the threshold of CT value, for example? Professor Lo also mentioned that he's trying to get vaccination going for those below 3 years old. Has any vaccine manufacturer submitted relevant applications? The experts have also argued that the PCR test should be concentrated for the high-risk regions, and we should drop the RTD operations. Daily RT test should also be dropped for schools. So what's the CHP's take on this? A question for Dr. Ho. At Queen Elizabeth Hospital, the intensive care unit, was there isolation facility at the ICU? Are patients listed as close contact? When did the contact happen? That is, when did the patient got admitted to the ICU? Will the ICU services be affected at the hospital? You mentioned that when HKICC reaches 50% capacity, the AWE will also be opened. Are we close to that point? And is there plan to reopen the Asia World Expo? The PCR test done in Hong Kong might be slightly different from that done in the mainland, but in terms of the specific differences and the CT values, well, I'm not an expert in this area, so I'm not in a position to give an answer on that. But if both sides can align the standards, that could save some of the work. And for those vaccination for the under 3-year-olds, we have an expert committee looking into the suitability of the arrangements in terms of the safety and efficacy. I don't have any further information on this. As for the opinions put forward by experts this morning, the Secretary for Health also commented on this. I don't have anything to add. As for the ICU, before testing, this patient had a surgery. After the surgery, the patient was under monitoring for a while. We weren't aware this patient had COVID at that point. And that's why some high-risk procedures such as intubation and the removal of the tube were performed, and the staff involved will be classified as close contact. And that's why they have to come under monitoring. And for the ICU, it's still operating. Now, as for the HKICC, Hong Kong Infection Control Center, we're monitoring the usage rate at the facility. If there is any update for phase 2 or phase 3 reopening, we will make an announcement at press briefing. Speakers not using a microphone. We follow the procedure, so they had the right PPE. Any other questions? If not, that concludes the press briefing here. Thank you.